Introduction to this literature review. Purpose. Explore if current manual patient-safe handling procedures taught in nursing schools prepare nurses for safe patient handling, and to improve patient mobility safety for caregivers and their competency by doing simulation training. Research question would be, how adequate is patient safety handling curriculum in nursing education programs to safely prepare new nurses in clinical settings? Background: a third of nursing students will experience back injury. Graham, 2020. Systemic safe patient handling education has decreased musculoskeletal-related leave by 26 to 30%. Carpia, 2022. Problem statement. Current traditional nursing education programs have deficits in students or new nursing preparedness for evidence-based safe practice handling for caregivers. Graham, 2020. With current educational programs, there is a high incidence of musculoskeletal problems among nursing students and new nurses due to improper and absent handling guidelines. Carpia, 2022. Significant in nursing practice, a 12-month study shows 71.8 to 84% of nursing staff do suffer from musculoskeletal disorders related to work. So it's really important that we develop these programs to avoid the negative physical demands many programs have attempted and have not been able to do that in the past. Methods, databases, the CINAHL and Google Scholar. Limiters, peer-reviewed English last 5 years, full text, search terms, safe patient handling and education. Results, 12 initial studies were read. The entire articles. They were narrowed down to 3 primary studies. Inclusion criteria was primary quantitative studies, peer-reviewed, and published within the last 5 years. Exclusion criteria was secondary, experimental studies, articles not peer-reviewed, and articles that date went past 5 years. Analysis of finding Article 1, Descriptive Quantitative Study, Level 6, Increasing Patient and Student Nurse Safety Using Safe Patient Handling. In this study, nursing students were given small group educational sessions over a 6-week period. They were given a pre-test before the sessions and a post-test after the sessions. They also had skill sessions with safe patient handling mobility equipment that was set up in 3 different stations, and they were demonstrated how to effectively and efficiently use the equipment. The results. Pre- and post-testing after educational intervention showed improved nursing student knowledge and skills after sessions on use of safe patient handling and mobility. Graham, 2020. Nursing students did improve their testing scores to 91% after completing educational sessions on the safe patient handling. Graham, 2020. Their pre-test scores were actually at 55%, so that was actually quite an improvement. Nursing students were able to correctly demonstrate use of safe patient handling equipment after their practice sessions. Graham, 2020. So they were able to show that they mastered the use of the safe patient handling mobility equipment. Analysis of finding for Article 1. Trends: increased use of practical sessions for teaching use of safe patient handling and mobility, increased use of assisted devices over manual handling, contraindications and gaps. Safe patient handling and mobility equipment can be expensive and may be cost prohibitive for nursing programs to purchase. Graham, 2020. Small sample size of 32 students that were first or second year associated nursing students from one program in Westchester County, New York. Graham, 2020. Implication: nursing school curriculum regarding safe patient handling and mobility needs to be updated to reduce risk of injury to patient and to caregiver. Analysis of finding Article 2. Cross-sectional descriptive quantitative study, Level 6. Safe Patient Handling Education. It's an analysis of European higher education institutes. In this study, there were surveys that were sent to educational healthcare professionals in Europe. It included Finland, Spain, Portugal, Lithuania, Estonia, and Slovenia. It regarded framework of teaching for safe patient handling education. The results came back that safe patient handling and mobility is not universally taught in nursing programs in England. Carpia 2022. Finland has evidence-based framework established. They do not rely on the government to set it up. They actually have done it all based upon the evidence they have found and how effective and efficient it is. 68.4% of the questionnaire respondents said they had a framework that teaches safe patient handling education, but stated that their guidelines they admit were inadequate. For example, half of the countries do not teach safe mobility. They do not teach mobility equipment and the use of ceiling lifts in their curriculum. Also, the curriculum on safe patient handling in these institutes do not meet the requirements of evidence-based practice and rely more on manual handling. Carpia 2022. Framework needs to be established to standardize safe patient handling, use and of risk assessment of working safely while moving patients. Analysis of finding for Article 2, Trends. Increase consistency in curriculum regarding safe patient handling in educational institutes in Europe. Increase the use of assisted devices to help increase safe patient handling. And to increase evidence-based practice into curriculum. Contraindication or gaps. Response rate to survey was low. Carpia 2022. In some organizations, survey was only given to leaders and not actually to the nursing students. Carpia 2022. And implications, education institutes in Europe need to change policy to evidence-based practice regarding safe patient handling. Analysis of findings, Article 3. It was a cross-sectional, descriptive, correlational, quantitative study, Level 6. The impact of manual patient handling and workability, a cross-section study in Brazilian hospital. This study assessed manual patient handling as it impacted an adequate workability and increased risk of lower back pain with healthcare workers in a Brazilian hospital. 43.42% of healthcare workers in a Brazilian hospital reported inadequate work associated with manual patient handling. Bernardes 2022. Manual patient handling increased inadequate workability for healthcare workers. Bernardes 2022. And more effective programs are needed to improve patient handling. Protocols designed by occupational health and safety measures, Bernardes 2022. They need them to facilitate and support a collaboration with management and to make the programs that educate and train safe patient practices. Analysis of finding for Article 3, Trends. The evidence in this article did support those from 1 and 2. Curriculum regarding safe patient handling in institutions and hospitals needs evidence-based changes to patient handling education. Manual patient increases risk of musculoskeletal injuries. Contraindications on this were it had the healthy worker effect. They excluded any healthcare worker that was on leave or modified duty. They also had a sampling from one hospital in Brazil, low participation rate, and not randomized. And the implications were interventions to maintain healthcare workers' working ability by limiting manual patient handling and focusing on using proper mechanical patient handling equipment. If we want healthcare workers to work for many years, we need to focus on proper mechanical patient handling equipment. Synthesis, discussions, and implications. As you can see, each study was laid out here. We have gone over the theme of nurse education for each one, policy, size of study, and implications. All three studies did risk healthcare workers due to current policy. They did have inadequacies in healthcare workers' education regarding safe patient handling, and a need to change education policies regarding safe patient handling. Limitations were lack of objective measures, they were all self-reported in questionnaires, and they had limited setting or pool of responses. In conclusion, policies in institutions and nursing programs should be implemented to patient handling devices instead of manual lifting to reduce injury risk. SOSA 2023. Teaching and training in safe patient handling to nursing students is essential to safe nursing in practice, clinical practice. Shin and Beck 2023. Recommendations for future research is to develop patient safety education programs for students and clinical nurses using diverse teaching methods and comprehensive evaluation strategies to enhance effectiveness and ensure use of safety practices. Kim 2025. Also, studies should be gotten from data with objective measures instead of the surveys and questionnaires that were done on all of my studies. Evidence-based practice policies need to really be established in schools and in institutions on safe patient handling using equipment in order to prevent less musculoskeletal disorders and for nurses to remain in nursing much longer. Thank you.